I've struggled with this my whole life. It just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
This is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center. This is the second case of the day on this Tuesday, very late September. The first case, the person didn't want it to be videotaped. This gentleman, who's a touch-up, said it's okay to videotape him. So this is a touch-up. The gland is gone. Actually, if you lift up, I've already marked him, but by the way, has no gland here. There's actually if you push in it, there's actually a hollowing out. If I remove gland again, I'm going to indent him, and that's something that we don't want to do. So I did him the very beginning of the year, in January, very beginning of this year, and I didn't have my curved cannulas, my serrated cannulas, my baby cannulas, but I'm going to touch him up. It'll take about an hour. I stand by my work, and he will have perfect results, even more perfect than what he had preoperatively. I'm going to show you now the preoperative photos from different views and the fat and the gland that was removed. This is where we're going to touch him up, giving a better indentation here where the blue is, and a transition zone, and really nothing up here. Stealth incisions again right there. No incision by the nipple at this time. Do all the work through the stealth incisions in the armpit. And he's going to have a better definition here, and really create negative space with my curved cannulas, my serrated cannulas, and my baby cannulas. Also, I did not do the deltopectoral groove last time. We're going to include that this time, so he's going to look absolutely amazing. I want perfection. He wants perfection. We want perfection. Everybody wants perfection, and I stand by my work. So I'm going to numb him, OR, and do the touch-up. So here we go with the numbing. We pump you up. A little pinch right there. Two ring, get underneath here, break this up a little bit. So now this is a revision. So we do not have to go underneath the gland anymore with the excision. So this is really just kind of breaking through, and this is wonderful to break through the scar tissue. It does absolutely wonders. And this is the way to go. An energy-based lipo is the way to go. Do not let anybody do liposuction, regular lipo, because you don't get skin tightening on that, and you'll just have loose skin. So what I'm doing here is, don't want to go much up here. Don't want to maintain volume up here. This is my transition. Definitely don't want to go up here. And I'm just taking this, and you can see it under here. Just taking it in, really freeing it up and melting it, freeing the nipple. And I want to really scoop right over here. You can kind of see me kind of doing this lateral edge. And of course, go very deep here, very deep. And my confidence has grown since I do so many of these that I can really scoop this edge. 5 ring. 2 ring, 5 ring. A lot more at the tip, a lot more around it. Knife, grenade. Please, sir, can I have some more? More?
Please, sir, I want some more.
What?
Please, sir, I want some more.
Please, sir, can I have some more? If you remember beforehand how it was like tough to get through, now it's like a butter. Show me a stick of butter. See, now again, I confident in what I do. I do so many of these. I'm going down hugging that rib cage. Getting better negative space than I did a year ago. Mo better. Lipo. See how much we get out of you. So again, getting underneath there. It's my twisty turny. All right, so this is my curved cannulas. It's like a sports car curving around the road. So again, a revisional surgery on this gentleman who looked great to begin with. Again, show him the pre-op photos. And we got another 700 or so cc's out of there of fat. This time I concentrated more laterally, inferior, and I created this beautiful deltopectoral groove. So this great deltopectoral groove. So once he gets, the swelling is down, he's got this huge deltoids. I mean, he'll look like he's like jacked, this huge deltoid. Again, the lateral and inferior aspect of the pectoralis major muscle. Great indentation here. He's swollen with 2 liters of fluid, but he is going to look amazing. He has no gland here. I can feel that, feel the little donut hole. If I go back in there, I'll create more scarring. We don't want that. And this is a much faster recovery. Beautiful results, local anesthesia. Again, you can see this jacked up deltoid here. And the results will be amazing. You have gynecomastia, call me, Dr. Lebowitz, 631-424-0101, 631-424-0101. Call me, we'll discuss, Skype, FaceTime, and get you in here. Thanks, and see you soon.